I'm Rachel Smith. I am a double board certified nurse practitioner. I'm the founder and owner of Aspect Wellness, which is a membership model medical practice focusing on medical weight loss and hormone optimization, really with the goal of partnering with my patients on a deeper level to help them optimize their health. And what we're aiming for, I think most of us, is robust health span and the longevity that modern medicine seems to be promising us. We really need to learn how to take the reins and take charge of our health. And that's what I am partnering with my patients here at Aspect Wellness to do. So thank you for joining me today. What I want to focus on today is that philosophical foundation of the work that we do, because I think it's important to differentiate what I'm doing here at Aspect Wellness with what you might find at any number of local diet clinics. Dieting has a long and rather torrid history. It's become very much in vogue again over the last couple of years with the introduction and popularization of some of the GLP-1 medications, Ozempic, Wegovy, Zepbound, Mounjaro. You've heard all of those names tossed around. You've probably, maybe you've tried some of those medications. And I think the amazing thing about those medications, as somebody who's trained and specializes in obesity medicine, I am thrilled that we have these tools available. I think what they offer to my patients and possibly to you as well is a new way of approaching weight loss, especially for people who have tried a lot of dieting and have felt very stuck with what they've tried in the past. I know you've heard other people talk about how these medications tend to turn off the food noise or the chatter in your brain, and that can be really revolutionary for someone who has really only tried starving himself in the past, and we know how well that works. So it's great. These tools have been fantastic. What they've done to the industry is really kind of blow it up. So as more and more consumers are interested in using these products, more and more healthcare providers, and even people who are not providers, even people who are really just stakeholders in terms of business owners, have gotten into the industry, so to speak, to ride the coattails of these popular medications. So what I am seeing as a specialist in this field is there's a lot of misuse of these medications. And unfortunately, for people who are trained in this field, it means that we're managing a lot of fallout from that misuse, where patients who have been started on these medications without the proper education and really any attempt at changing their nutrition or their lifestyle, they do end up losing weight. But unfortunately, what we've found, and I'm sure you've heard about this as well, is those individuals are losing a great deal of skeletal muscle as well. And that's a problem because our muscle is the primary driver of our metabolism. And we know that the more muscle we hold in our body as we age, the greater the chance that we're going to age with robust, good health, and the lower our risk for all of the diseases that we die of in this country. So we want to hold on to our muscle as we age. If we are using weight loss tools that eat away at our muscle because they effectively cancel our appetite and leave us with no desire for food, so it's actually quite easy to starve yourself, that's a problem. That's a problem. So I think as a provider who uses these tools with my patients, I find that it is sometimes a very delicate line that we're walking. I want to be able to offer effective and safe tools to patients, but it's my job and it's my ethical responsibility to use them in a safe way and to educate my patients, and whenever I have the opportunity, the public at large, about how to use these medications safely and what does it really take for lasting weight loss.